I ultimately had a shoulder arthroscopy that included a bicep tenodesis and a rotator cuff repair. Post-op for patients that I take care of with that kind of constellation of problems, they would be on pain medicine anywhere from 2 days to 2 weeks. And I had just an unbelievable experience with Game Ready, and with compression and cold combination. I think I took 2 pain pills in the first 2 weeks. It's ideal because it applied uniform cold and compression. So I had no funny spots in terms of swelling. I had no real issues with any wound healing. Like I said, if you looked at my shoulder 2 days post-op, it didn't look like I had surgery. Neither one alone is as good as the two together, the compression and the cold. And I appreciated, each of them. I'd say 1 + 1 = 3. Well, for me, believe it or not, I wasn't really a big prescriber of it. We've offered it to our patients for a couple of years, and I was probably one of the low-end utilizers. But after the personal experience I had, if we can get adequate cuffs for the wrist, for the elbow, we already have them for the shoulder, and I'd be using it, or at least be offering it to patients routinely for any post-op trauma. Patients that I take care of with similar problems, like I said, they'd be on pain medicine, like I said, anywhere from 2-3 days to 2 to 3 weeks. So oftentimes at their first post-op visit, we're refilling their pain medicine. So people that I can now encourage to use compression and cold therapy like Game Ready, I figure we can cut down all that dopey feeling and all the narcotic medicines, or maybe not all, but certainly a large proportion. I think good experiences like this, it's kind of like how do good doctors get more patients. We don't advertise, right? It's your patients that do a lot of the advertising. So I think getting docs familiar with it, because it's cumbersome and it's daunting when you first look at it. Looks like, wow, such a big apparatus. Is it something that people really want to pay for? And I think if it's benefiting their patients and keeping them off pain medicine, and you've experienced that enough times, you'll say, hands down, it's worth it. So.